My name is Tatiana Borges.
My name is Juan Sebastián Lara.
We are a student of psychology of fourth semester of UPTC.
The name of article is Drug Dependence, Mental Impairment and Education.
The drug addiction has become a serious public health and behavior problem among young people in the community.
Keywords.
Dependence is a psychology craving for habituation to abuse for a psychology reliance on a chemical substance.
Mental distress describes a range of symptoms and experience of a person's internal life that are commonly held to be troubling, confusing, or out of the ordinary.
Psychoactive drug is a chemical substance that crosses the blood-brain barrier and acts primarily upon the central nervous system, where it affects brain function, resulting in changes in perception, mood, cognition, and behavior. The substances more used by students are alcohol, cannabis, tobacco, benzodiazepines, amphetamines, cocaine, and crack, among other illegal substances.
Cocaine dependence, in particular, represents a complete psychiatric disorder in the population.
Likewise, the cannabis is the most consumed illegal substance within the world, and its use has increased throughout the last decades, especially among students in school and in high school.
Abuse of this substance contributes significantly to a poor academic performance and school dropouts. Besides, the chronic use of cocaine had been associated with the impairment of executive functions.
But what are the executive functions?
These mental processes are characterized by the ability to plan goal setting and organizing behavior for decision making, working memory, attention span, as well as self control.
The neuropsychological tests in these individuals show poor performance in relation to tasks demanding planning, decision making, working memory, attention span, and self control.
Cannabis, after a few years of use, causes cognitive impairment in organizing and integrating complex information and in attention span and memory processes.
Cannabis abuse, even after shorter periods, may impair psychological function in addition to causing dependence.
Within the cognitive sphere, substance abuse may affect the learning process, concentration, attention span, and memory.
The magnitude of cognitive impairment is associated with variables such as duration, frequency, and the amount of cocaine and other substance abuse.
In addition to the occurrence of cognitive impairment, students affected by chemical dependence report other symptoms such as depression, anxiety, personality disorders, circadian rhythm disturbance, aggressive behavior, and psychosis.
Psychosis is included among the more severe psychological conditions of cocaine dependence, and patients show subjective intense feelings of destructive behavior or fear of being harmed, despite knowing that it is irrational.
In consequence of chronic cocaine use, patients present physical and functional change of several brain regions, such as prefrontal cortex and anterior cingulate cortex areas closely related to executive functions.
Subjects with a longer period using cocaine presented more severe depressive symptoms. Individuals that have begun to use cocaine too early each presented severe symptoms of anxiety.
Young people are probably particularly vulnerable to the deleterious effects of cocaine on mental function and on behavioral self-control. The maturity of their emotional and cognitive skills may partially explain this vulnerability. The chronic use of cocaine together with mental variables such as depression, anxiety, psychotic symptoms, and behavior disorder could interact increasing mental impairment.
The deficit causes big cocaine on executive functions, damage the ability to set goals and making decisions. In addition to damaging the cognitive processes responsible for staging in school. Cocaine-dependent individuals present a significant vulnerability in controlling their impulses, and this phenomenon hampers their ability to set goals and continue their formal education for long periods of time.
In conclusion, young people who persistently abuse psychoactive substances often experience an array of problems, including academic difficulties, health-related problems, including mental health, poor peer relationships.
Additionally, there are consequences for family members, the community, and the entire society.
Thank
Thank
you.
you.